Well, it is estimated that 1 in 6 people will experience a stroke in their lifetime. This Sunday is World Stroke Day. So today we have Dr. Thomas Wolfe, a neurologist with Aurora Healthcare, with us to help better understand strokes and how we can try to prevent them. So first of all, what is a stroke?
A stroke is essentially a brain attack, and commonly, the most common cause is that there's a blockage in an artery, which is feeding the blood to the brain. And you could also have situations where that artery may burst and you'd have bleeding either onto the brain or into the brain.
So is there a pattern as to who this happens to and when?
Most commonly, it's older patients that would have multiple medical problems, but what we're seeing is that younger and younger patients are having strokes.
So is there a reason for that trend or why you're seeing a change?
It may be related to uncontrolled risk factors, things like ongoing smoking, obesity, and not taking care of the medical problems that may be there, not taking medicines.
Okay, so we've heard the warning signs about those particular issues. So when you talk to people about the best way to prevent this, you would tell them?
The best thing, stop smoking if you are a smoker. Earlier on the news there was a bit about exercise,
yes.
So being active. The American Heart Association recommends 5 times a week, about 30 minutes a day, getting your heart pumping, aggressive aerobic activity.
So exercise is a key.
Exercise is very helpful. Diet is also important. Avoiding the carbohydrates, fatty foods, trans fats, keeping low sodium diet.
So when you look at the trend and what's happening, are you making progress in trying to reduce the number of people who are
there has been improvement in the number, but more importantly, we're making more patients survive. Unfortunately, there's still a lot of disability that would come from stroke. So identifying a stroke early, activating the emergency system in order to urgently be treated is one of the most important things.
Well, you say identify early. Of course, you've given sort of the indicators that might lead someone to a stroke, but what about, am I having a stroke? Will I know?
Stroke is typically painless. Sometimes you can have severe headache, which may be one of the symptoms, but typically you don't have a warning like you would have with a heart attack. So there are certain symptoms, and we use a saying, be fast, which is also to say act very quickly if this would be happening, but it also stands for a set of symptoms. So B could stand for balance. If you're having trouble walking, staggering to one side, and all of these symptoms are typically something that would happen suddenly.
Okay, those are good symptoms to know about. We're going to have more of those on our website, so we appreciate you letting us know about that. And one of the places you can go to find a lot of what he's just talked about is at the Stroke Prevention and Treatment, which is at the aurora.org location.